Okay, so next we have the ventriculectomy or sacculectomy, and this is the Hobday procedure. So this time the horse is in dorsal recumbency, it's not laterally, and you do the incision medially. So what this procedure is removing the mucosal lining, so the ventricles or the saccules of the laryngeal ventricles, and this is called also this way compared to the vocal folds, through a laryngotomy or through a transendoscopic laser excision. So basically either tools or lasers. And it's usually performed to get rid of that noise we were mentioning earlier. It doesn't really affect performance though, unlike the other surgery. And a laryngotomy is made under general anesthesia. Of course, we mentioned in dorsal recumbency, or we can use neurolept analgesia in a standing horse. So yeah, let's go through the procedure. So you do a 10 to 15 centimeter incision in dorsal recumbency, and it's along the ventral midline from rostral to the palpable keel of the thyroid cartilage, so you can feel it here. Yeah, and you do it just beyond the cricoid cartilage. Oops, sorry. So the septum of the paired sternothyroid, I'll just show you, sternothyrohyoideus muscle is, sorry, it's divided, so use the retractors. So just imagine this muscle is the sternothyroideus muscle, it's retracted, and the muscles are separated, and you have the cricothyroid membrane and underlying mucosa. It's incised along the midline, and then you perform your sacculectomy. When you finish the laryngotomy as well, the surgeon has two choices. You can leave the entire incision open to close the cricothyroid membrane, or you can use a simple interrupted absorbable suture. And there's also a Blattenberg burr. What do we use that for? So a Blattenberg or Williams burr can be fitted into the ventricle to as far as it can go in the larynx, and is twisted to engage the mucosa in the projections on the burr, and it's then taken out slowly from the ventricle, allowing the everting of the attached saccule. So I guess the saccule just falls after fitting in the burr. And then you have large forceps like a Carmolt or curved crial, which is placed along the everted saccule, and this allows traction of the entire saccule. It's pushed out, so everted, and then it's cut with Metzenbaum scissors. So yeah, neither of these are Metzenbaum scissors. And the same procedure is repeated on the opposite ventricle if it's a bilateral, because remember it's going to be on both sides. So this is being done here, it will be done here, because we're just seeing the cross section here. And that's it for my videos. You'll move on to Thanos's videos after this. This is slide 213. Thanos started from 214.